So what I want to know is, who is this person, and what are their values, and how are they approaching this ultimate and most difficult decision right now? Are they approaching it the way they would usually and normally approach it? Or is there something that is greatly distorting and impairing their ability, such that their decision might be irrational and unreasonable, not only relative to how others, hypothetically in the same situation, might approach this decision, but relative to how this individual usually and normally would have approached this decision. It's tricky, though, because it's not necessarily abnormal to be depressed in the context of terminal illness, imminent death, and especially impaired quality of life, suffering. So we're trying to assess whether the person is competent to make this decision, and we use the usual competency criteria for decision making. And we ask ourselves for each element of those criteria whether and to what degree depression is distorting and impairing their competence. So depression in and of itself and the bias and distortion does not render someone incompetent to make a decision. It's a question of degree. We would consider the standard competence criteria for important treatment decisions, and we would need to try to assess to what degree each of the elements of competence is being severely distorted and impaired by the depression. It's not all or nothing. So someone can be depressed and still be competent. One of the clues would be, is the person's choice that they're making consistent with their prior and long-standing values? Now, people can change their minds about their values, but this is an important and helpful marker as to how rational and reasonable this decision is relative to the person's usual self. So in the end, it's a delicate balance. We're walking a fine line as physicians between respecting the person's autonomy, which is the overarching principle in MAID, their right to decide how they die and when they die, versus protecting the individual from vulnerability, from severe vulnerability, making a decision that would be markedly irrational and unreasonable by their own standards compared to their usual self as a result of depression.